I welcome everyone to my channel. My name is Bayduletov Arslan, and today's topic of my video is obsessive-compulsive disorder and methods of its treatment. Obsessive-compulsive disorder, or OCD, is a widespread mental pathology, often disabling the patient. Despite the great achievements in psychopharmacotherapy of these conditions, mainly associated with the use of a new class of antidepressants, the drug treatment is not always effective enough and moreover requires the appointment of high doses of medications for indefinitely long periods. Therefore, the psychotherapeutic treatment of OCD patients remains very relevant. Theories of the occurrence of OCD: impaired metabolism of norepinephrine and serotonin. This increases the level of anxiety. The theory proves the effectiveness of taking antidepressants. Hereditary factor. When examining patients, it often turns out that their close blood relatives also suffer from OCD. A mutation of a gene located on chromosome 17 may contribute to the development of the disorder. It is responsible for the transport of serotonin. Autoimmune causes. The theory of Panda syndrome explains the development of OCD by infection with streptococcal infection. Exposure to streptococci causes an autoimmune reaction. Antibodies affect the basal ganglia involved in the process of higher nervous activity. The growth of the research interest in obsessive-compulsive disorder in the last decade is largely due to their high prevalence in the structure of mental pathology. According to a number of studies, OCD accounts for 2-3% in the general population. St. Montgomery professor assigned OCD the first place in terms of prevalence after drug addiction, affective disorders, and phobias. The symptoms of obsessive-compulsive disorder are inextricably linked. Example: a person suffering from OCD casually takes up a dirty handrail on a bus. There are thoughts of infection with a dangerous disease. The patient begins to worry about himself and his loved ones. Anxiety will not recede until such a person performs a compulsive ritual. The ritual will not be limited to washing hands. The procedure can be repeated 3-4 times, or it's tied to a certain time, place, or algorithm. The most effective treatment today is cognitive behavioral therapy. Already in the first months of treatment, patients recovered from the main symptoms that had been tormenting them for many years. During cognitive behavioral psychotherapy, the functioning and structure of the functional system of the brain and its connective connections changed. The therapy performed change to obsessive thoughts, significantly reduced the intensity of impulses aimed at repetitive movements, which disappeared quite quickly. Cognitive behavioral psychotherapy allowed patients to resist OCD, changing or simplifying the procedure of rituals, reducing it to a minimum. The basis of the technique is a patient's awareness of the disease and step-by-step resistance to its symptoms. In the presence of rituals in the patient, improvement usually occurred when using a combination of a method of preventing a reaction by placing the patient in conditions that aggravate the rituals. After such treatment, the severity of the rituals decreased, as well as the accompanying obsessive thoughts receded. In cases of predominance of ritualized phobias, along with desensitization, behavioral training was actively used to help overcome avoidant behavior. Also, the method of stopping thoughts was used. So, it can be concluded that psychotherapy is extremely important for people suffering from obsessive-compulsive disorder. If you are not treated start your disease, it may not just progress, but begin to cohabit with a new disorder, which will worsen further rehabilitation at times. Neglect of the course of obsessive-compulsive disorders also leads to a depression. So, thank you everyone. See you next time.